Hi everyone, it's Justin. Today we're going to talk about Seroquel, also referred to as quetiapine. Seroquel is used as a medication, a prescription medication, used for schizophrenia in people 13 years of age or older, bipolar disorder in adults, which includes depressive episodes associated with bipolar disorder, manic episodes associated with bipolar 1 disorder alone or with lithium or divaloprex. Long-term treatment of bipolar 1 disorder with lithium or divaloprex as well. And manic episodes associated with bipolar 1 disorder in children aged 10 to 17 years old. It is not known if Seroquel is safe and effective in children under 10 years of age or younger. As with any medication like this, we want to highlight some concerns. There is a risk of death in elderly patients. Medicines like Seroquel, quetiapine can increase the risk of death in elderly people who have memory loss, can be called dementia. It's not for treating those individuals with psychosis in the elderly with dementia. There's also a risk of suicidal thoughts and actions, which antidepressant medicines, depression, and other serious mental illnesses, and suicidal thoughts and or actions. Talk to talk to your family member's healthcare provider about all the risks and benefits, treatment with antidepressant medicines, and all those treatment choices that you have. Again, antidepressant medications may increase suicidal thoughts, actions in some children, teenagers, and young adults within the first few months of treatment. Depression and or serious mental illnesses are the most important causes of suicidal thoughts and actions. Some people may have a particular high risk of having suicidal thoughts or actions. These are people that include who have a family history of depression, bipolar disorder, also called manic depressive illness, or suicidal thoughts or actions. Uh, so we just want to watch as family members, and we want to reach out to a healthcare provider if any of these signs come up. Also, if symptoms like thoughts about suicide or dying, attempts to commit suicide, new or worse depression, new or worse anxiety, if we feel more agitated or restless, have panic attacks, trouble sleeping like insomnia, new or worse irritability, acting aggressive, being angry or violent, acting on dangerous impulses, an extreme increase in activity and talking, which is referred to as mania, other unusual changes in behavior or mood. What else do I need to know? What else do you need to know? Is never stop taking an antidepressant medicine without first talking to your healthcare provider, because this could cause other symptoms. They're used to treat depression and other illnesses, and we want to discuss all the risk of treating depression and the risk of not treating it. Patients and their families and caregivers should discuss all those treatment options with the healthcare provider, not just the use of antidepressants. Again, there's other side effects that can occur, and not all of antidepressant medicines prescribed for children are FDA, Food and Drug Administration, approved for use in children. So again, in that case, talk to your children's healthcare provider for more information to go on. Uh, Before you start taking Seroquel slash quetiapine, you want to tell your healthcare provider if you have or have had diabetes or high blood sugar with you or your family. Your healthcare provider should check your blood sugar before you start and also during the therapy. High levels of total cholesterol, triglycerides or LDL cholesterol, or low levels of HDL cholesterol. Low or high uh, blood pressure, low white blood cell count, cataracts, seizures, abnormal thyroid tests, high prolactin tests, heart problems, liver problems, any other medical condition. Pregnant, plan to become pregnant. If you become pregnant while taking Seroquel, quetiapine, you should tell your healthcare provider, and you'll probably want to register with the National Pregnancy Registry for atypical antipsychotics, which you can reach them at 1-866-961-2388, or go to womenshealth.org/clinical and research programs/pregnancy registry. Also, if you're breastfeeding or have plans to breastfeed, because this medication can pass through the breast milk, or if you have had where you've been able to not completely empty your bladder, which is referred to as urinary retention, having a large prostate or constipation, and increased pressure in your eyes. Want to tell our healthcare provider about all the medicines that we take, including vitamins, herbal supplements, etc., over-the-counter medicines. And by taking different medicines, herbals, those could also interact with each other. So we want to make sure we take that and let our healthcare provider know. How should we take Seroquel, quetiapine? We want to take it exactly how our healthcare provider tells us. We don't want to change the dose ourselves. Take it by mouth, with or without food. If you need to stop, talk with your healthcare provider first, because you may have bad side effects, including trouble sleeping, trouble staying asleep, nausea, and vomiting. If you miss a dose, take it as soon as you remember. If your next dose is close, skip the missed dose and just take the next dose at the regular time. Don't take the two doses. Do not take two doses at the same time unless your healthcare provider tells you. If you're unsure what to do, talk to your healthcare provider. What should I avoid while taking Seroquel, quetiapine? We don't want to drive, operate machinery, or do other dangerous activities until we know how this will affect us. It can make us drowsy when we take this medication, and we want to avoid getting overheated or dehydrated. Do not over-exercise. In hot weather, stay inside in a cool place if possible. We want to stay out of the sun. We don't want to wear too much or heavy clothing. We want to drink plenty of water, and we definitely don't want to drink alcohol while taking quetiapine/Seroquel. It may make some of these side effects even worse. So some of the serious side effects that could come into play with this, a stroke that can lead to death, can happen in elderly people with dementia who take medications like Seroquel, quetiapine. Neuroleptic malignant syndrome, NMS, is a rare but serious condition that can happen in people who take antipsychotic medicines, including quetiapine, Seroquel. NMS can cause death and must be treated at a hospital. Call your healthcare provider right away if you become severely ill, have any or all these symptoms: high fever, excessive sweating, rigid muscles, confusion, changes in our breathing, heartbeat, increase or decrease, blood pressure falls can happen, and falls in general physically can happen with those who take this particular medication. High blood sugar, which is hyperglycemia, can happen if you have diabetes already, or it could lead to the buildup of acid in our blood due to ketones, coma, and death. It can cause us to become thirsty, urinate more than usual, feel hungry, weak or tired, sick to our stomach, feel confused. levels of fat in our blood, and an increase in weight. This is not all, but this is intended to help us understand more about Seroquel and quetiapine.